Today we will talk about hyperlipidemia or high cholesterol. There's a lot of confusion in the public right now about that. A lot of patients who have high cholesterol will end up on some sort of cholesterol medication, whether it would be beneficial for them or not. Obviously, a lot of patients who have had strokes or heart attacks will end up, pretty much 100% of them will end up of some kind of cholesterol medication. So let's talk about cholesterol. Let's talk about why the testing that is currently done may not necessarily be the most accurate. And I'll give you ideas of how to test it accurately and what to look for. So cholesterol is a chemical, basically, that is very, very important in our body's function. 25% of our brain is made of cholesterol. Every hormone in our body is made of cholesterol. So it is a very, very important compound. It is not here to kill us like a lot of physicians think. So we don't need to drop our cholesterol to nothing. There is not a single person who survived without any cholesterol in their body. Just impossible. Okay? So that's a number one understanding that we need to, number one distinction that we need to make, that cholesterol is here to serve a specific purpose and it's not necessarily harmful. It may be harmful, and we will talk about those situations, but overall, in a big global picture, it is there to serve us. Okay? Now, on a regular test, on a regular cholesterol test, we test 4 parameters. Total cholesterol, LDL particles, HDL, and triglycerides. So total cholesterol is basically sum of all cholesterol particles that we have in our body. LDL, calculated LDL, is actually not a direct measurement of LDL particles. And LDL particle is a compound of different proteins that are combining together to carry cholesterol from one side to another. Okay? So cholesterol in reality not only serves us as a precursor for our hormones, but it also is a carrier molecule, and it is serving us to remove some of the debris of inflammation or deliver more cholesterol to the area where we need to have a repair. So if we have some injury or if we have a lot of inflammation, our body naturally will produce a lot more cholesterol. In fact, 75% of our cholesterol is actually produced by our liver, and only 25% of cholesterol is absorbed through our food. So when people say, well, you know, we need to eat a low cholesterol diet, yes, sometimes it is helpful, and in certain patients, and again, we'll get to that in a second, but vast majority of cholesterol is actually produced by our liver. Okay? So that is also an important fact that has been established already for many, many years. So when our liver senses or our body senses that we need to have more cholesterol delivered or removed from area, it will produce more cholesterol particles to start moving it around. So LDL, when it's a lot of LDL, it's considered to be bad cholesterol. Again, we'll talk about distinctions in a second. HDL is considered to be good cholesterol. Again, there are a lot of caveats to that. Some of the HDL is good, some of them of HDL may not be so good. Triglycerides, pretty much universally agreed that there's really not a massive benefit of the high levels of triglycerides. Triglycerides are actually produced from a glucose. So imagine that we consume glucose and our body is oversaturated by glucose. So extra glucose that cannot be absorbed in our cells will go to the liver. It will be packaged in triglycerides and then it will be released back in our body to store in a fat tissue. So in reality, vast majority of the high elevation of triglycerides is related to abnormal metabolism of glucose. There are certain familial hypertriglyceridemias that in those patients, the triglyceride levels are profoundly high and they need to be much more aggressively treated. But again, a lot of them will improve dramatically also with a low carbohydrate diet, for example. Okay? So those 4 parameters that's all that vast majority of the physicians look at. and they make a decision and they put patients on cholesterol medication, typically statin, typically Lipitor or any other medication in that class, that will suppress our liver's ability to produce LDL, to produce our cholesterol, to synthesize that cholesterol. So again, that decreases our ability to do what cholesterol is supposed to do, to produce our hormones, to repair and remove all the debris. So use of those medications have been linked to development of diabetes, to development of Alzheimer's, and also about 50% of heart attacks, that actually has been studied, occurs in patients who have normal cholesterol. So what does it mean? That maybe those 4 parameters are actually not enough, and we need to look at more parameters to figure out whether the cholesterol that we have is actually dangerous or not. Well, let's talk about what other parameters we can look at. So LDL, again, this is a carrier molecule, so basically like a truck. And that truck is kind of chugging along in our bloodstream and carries stuff from place to place. If it's a large truck, then it will kind of bounce around in the vessel and will get to where it's supposed to be. And it's not going to get stuck in the little crevices because it's too large. It's called big and fluffy LDL. And they are commonly considered to be more benign. On the other hand, the small and dense LDLs, or really tiny trucks, will get in the little crevices, will get stuck there, and they consider to be more atherogenic or increase your chance of developing plaque in your vessels. So those are bad. On the other hand, for example, your LDL number is 70, which is kind of dream number for cardiologists and stroke neurologists. We want to have it less than 70. So if you have LDL of 70 consists of large and fluffy LDLs, then you are really in good shape. If you have a LDL of 70 consists of small and dense LDLs, then you have much more particles, but still the number would be the same. So it is much more dangerous, and actually you will still have a very high danger of developing more issues with your cholesterol related problems, health problems. So we have to have a distinction between them. Also, the sheer number of particles of LDL or LDL particle number is much more accurately represents really how many LDL particles we have than a calculated LDL. So sometimes we have too much of good things, too much of large and fluffy LDLs. Then again, they will bounce around, but there are too many of them. It will be traffic congestion. So they will cause potentially some slowing in the blood flow and cause more problems. So we don't really look only at the size of the LDL, but we also look at the particle numbers. Same thing happens with HDL. If there are very dense HDLs, they actually may not be necessarily helpful because they don't carry that much cholesterol out. If you have a large and fluffy HDLs, then yes, they are very protective because they will carry a lot of cholesterol out back to the liver for processing. Again, triglycerides are very, very dangerous when they're very high, so we want to keep them really below 100. That's the optimal number. The norm is below 150 on vast majority of the labs. But again, in reality, if you are eating less sugar, then the triglycerides should be below 100. Okay, so those 4 numbers just broken down a little bit more. So what increases our risk of having a lot of small LDLs, the really bad LDLs? Well, inflammation mostly. Inflammation and insulin resistance. So there are tests that not only break down those LDL particles, but also tells us whether there is a lot of insulin resistance in a patient, because that again will increase your chance of converting these good and big and fluffy LDLs to smaller and more dangerous ones. There are other proteins that also have been linked to a higher chance of developing strokes and heart attacks, like apoprotein B or lipoprotein small a. So those are typically not measured in the regular tests, but if they are elevated, then they really need to be addressed in order for us to decrease the chance of developing strokes and heart attacks or some other badness. Okay. There are also a matter of oxidized cholesterol. Oxidized cholesterol is a damaged cholesterol. So there is a way to measure that. And again, if patient will have a normal cholesterol on the panel, they will be on the cholesterol pill and everything looks really, really good, and all of a sudden they have a heart attack. Well, most likely one of the other parameters that I talked about were not addressed and were not corrected. And unfortunately, truth be told, that for example, lipoprotein A, there are certain difficulties of controlling that. And there are not many medications that will control lipoprotein A. There are certain supplements that can help that. Also, decreasing insulin resistance will significantly also improve your cholesterol levels as well. So, not all LDLs are dangerous. Number one, you have to have a much better assessment of your cholesterol and your particles than just a regular cholesterol panel. And you have to be thoughtful of what may be contributing to your high cholesterol. The other problem that we talked about, that 25% of all the cholesterol will be absorbed through your gut. Well, some patients are so-called hyperabsorbers, and that actually can be tested for. So in those patients, if they are hyperabsorbers, yes, they will benefit tremendously from eating less fat and less cholesterol in their diet. But again, you have to test yourself for that prior to deciding that that's what you're going to go with. Okay? If you like this video, please subscribe to this video. I want to spread this word to a lot more patients because a lot of patients are confused. Every day in clinic, I am asked about cholesterol, how to test it, whether they need to be on cholesterol medications. So please help us to promote this channel to other patients so they will get the same benefit as you guys doing. Following this presentation, you'll have a small slide discussing how you can work with me if you would like to do that.